We need to discuss the real-world implications of these unfunded federal mandates, as well as the lack of flexibility and the fair penalties that many of our communities are facing. The affordability of water and wastewater infrastructure is a critical concern around the country. In my home state of Nebraska, the city of Omaha is faced with the challenge of addressing a $2 billion unfunded combined sewer overflow mandated from the EPA. And the cost to the 600,000 residents in Omaha's sewer service area is a burden, and it's particularly hard on our low and fixed income residents. So, Mr. Mayor, I would like to ask you a question. In your testimony, you discussed the extensive and the costly process that your city endured to reach an agreement with the EPA's required CSO mandate. And in your experience, what are the necessary tools that Congress can provide municipalities and communities to better equip themselves to comply with those mandates with the CSO?
Thank you, Senator. I believe that, first of all, one of the critical elements of integrated planning is the opportunity to prioritize. And for an example, we have SSOs in our community that we demonstrated had no public health impact or environmental impact, but which will cost us $30 million to eliminate. We were able to push those off to a later time while we took on much more serious issues relating to the CSOs. That ability to prioritize is part of integrated planning. It needs to be part of the law. It shouldn't just be a policy. The second issue really is around affordability. And the Conference of Mayors has developed proposals for how to, in fact, define affordability based upon not MHI, because median household income really masks the impact that these costs will have on low-income households. And we believe that a definition of affordability, which absolutely respects the need to do something, but to do it within the affordable limits of a community's resources, is important to ultimately getting to solutions. And we think that additional time. You know, the Clean Water Act just had its, I think, 42nd birthday. What we've accomplished didn't happen overnight. What's been accomplished to the nation's waters, in fact, took 40 years to get to this point, and we're still making advances. So any expectations, which are there in the regional offices, that things must be accomplished in 10 or 15 years as the norm, really are not realistic. So part of the challenge of dealing with affordability is allowing for the kind of time that communities need to accomplish it within their budgetary means.
Right. Could you speak a little more on the necessity to address those high priority control measures, and specifically what impact does that prioritization have on public health and water quality? How can we have Omaha be able to benefit from that prioritization flexibility?
Well, I think that comes back to a technical assessment of where in any system there are places where things are happening at higher levels, more frequency events, and then there are places in systems which do not have that kind of frequency or impact. And I think assessments of the entirety of the solution and then plotting that over time for implementation is the key to ultimately getting to something that's reasonable for any given community.
Thank you. And Mr. Chow, the mayor just spoke about the medium household income, and in your testimony, you spoke about the impact on EPA when the agency looks at the community's affordability to cover the unfunded mandates. And you specifically mentioned that the benchmark that's used there. Could you explain why that medium household income benchmark is harmful to our low and fixed income families?
Sure. And of course, as I mentioned, Baltimore, 40% of our populations in the cities are below median household income at this level, and 25% of the population is below the poverty line. So when you're looking at just the median household income, the curve is skewed. You're sort of looking at
So what should they look at?
they should be looking at the low end, meaning the folks who are most vulnerable, and because that's the greatest economic impact is to that population. As we raise water rates, for example, we raise water rates across the board. So, so in essence, what the local end up having to do is that we have to come up with programs that will assist senior citizens as well as low-income citizens to help offset. So, so looking at the low end is actually will be more practical and more reasonable for us.
Thank you.
Thank
You know,
you.
Mr. Chairman, we have a lot of low-income residents in Omaha and people on fixed incomes who are being hit right now with their water and sewer bills, and so anything we can do to provide that flexibility to help those folks, I would really appreciate it. Thank you.